Hi, my name is Brittany Sloom, and I am an LPN at Lourdes College of Nursing, and I am making this video for my final exam for my nurse leadership class. So one of the things, one of the weaknesses the leadership weaknesses that I think that I had, that I've found out throughout this class was just thinking that I am not a leader. So according to 10 leadership theories in 5 minutes, one theory that I have looked at is called the great man theory, and this means leaders are born and not made. So for me, that was one of my weaknesses because I never thought that I could be a leader. And but like I've realized through taking another class and during questions class and with this nurse leadership class that I'm wrong. I've realized, I was born to be a leader, and it took me 28 years of living to realize that. And I think for me, like one of the things that makes me a powerful leader is that people can relate to me, and I feel like I have a strong mindset because like I know I can lead, and that like I can show people that anyone could. So that's one of my weaknesses, or was one of my weaknesses, is just underestimating myself. And I think I was born to lead, and that's one of my strengths now, is like just realizing that. So it feels really good to just realize that now. Yes, I know I can influence practice when it comes to healthcare practices that need to be implemented. I say monkey see, monkey do. So if I feel like I'm a positive person, so if people see that I'm positive, then it could in turn, have them be positive. And just like our quality improvement project we did for this class, we did hand washing. So the nurses, the aides that I work with, other healthcare professionals, even like housekeeping, if they see me washing my hands before going into a patient's room, after coming out of a patient's room, then I think that that's gonna help and allow them to wash their hands even more too. And hand washing is it's cost effective. It's just hand washing. So that's why I think it's so important. And hand washing is the #1 way of decreasing infection spreading, through transmission of hands. So yes, I think that I could easily help implement, healthcare practices, especially hand washing. And one topic I think I need to develop on more is just looking into evidence-based, really anything. And I say this too, not that I implement as an LPN, not evidence-based, but I think I need to be better at just knowing more. You're always learning, and nursing is always changing, but just like having that knowledge in the back of my head, I'm doing this because of this. We do this because of this. And just like thinking about that every time I'm doing something. The plan I came up to implement this is just looking at nursing books. Even my care plan book that we use for care plans in the nursing program, those have evidence-based rationale. So even I could look at those. And I give myself now until December of 2021 because that's when we graduate. But I do definitely want to continue that even after graduation. So my short-term goal professionally, I would like to find a nice paying job. I grew up with a single mom, and I seen her struggle just with me. And that is something, I don't have kids right now, but that is something that is near and dear to me. Like, I'm gonna start tearing up. I don't want to have to struggle like I seen my mom struggle. So nursing isn't about the paycheck, but when I love it that much, and then if you do find a nice paying job, it means that much more. But finding a nice paying job in management, I think but really implementing great healthcare changes for both patients and staff members. I see a lot of times, unfortunately, companies don't do what's best for patients or even staff members, and I hate that. I think healthcare has just gotten away from like what it really means. So I just want to be a part of that to help change that. I do want to, for my short-term goal, look at MSN programs and possibly apply to one. My long-term goal would be obtaining my MSN and go from there. And then just continue to learn other nursing opportunities. I just want to continue learning in every aspect. I love asking questions. I love at my job now, like, witnessing new things. I'm always asking like other nurses, if I could go see this, or even at clinical, can I go see this? I always want to learn. And one way I want to give back in nursing is showing my empathy. I've seen way too many nurses not care. They don't give a darn about their job, their patients. They're just honestly in it for a paycheck, and I think that is just horrible. I want to show that there are caring nurses out there, whether it's the patients or the staff members. And I found this, according to Menks, good leaders humanize themselves so they can see things as they are. But also, this allows the world to see that the leader, how they really are. And I think that's really important because it creates a new opportunity for others to step into a leadership role. So, just going off of that, like that can allow me to step into a new leadership role. And in closing, I just want to thank this class and Marge for allowing us to grow in leadership, and I'm really excited to see how I progress, from LPN to then RN, and especially with my bachelor's and growing into a leadership role. And I think that what we have learned with this class will really, really help, and I'm very grateful for it. So thank you very much.